Now directly into clinical action. We're seeing here the PI, patient interface, cone applanated on the patient's cornea, very large area of applanation, and please note where the limbus is visualized through the PI. A huge area of applanation. This is the actual femtosecond treatment plan. Um, we're going to see an 8.5 millimeter diameter flap for myopic LASIK. First, the vent chimney through the limbus. Please note the remarkable speed of this femtosecond laser, under 10 seconds for a complete flap. Perfect flap, as you can see here. And please note the 8.5 millimeter flap in conjunction to the rest of the cornea, showing you how large of an area is being applanated, a clear advantage in hyperopic cases. We're going directly into the excimer laser now. You can see the aiming beams, the red aiming beams. This is a unedited as far as the femtosecond and excimer laser procedures. We use a purely disposable instrumentation, aspirating speculi, draped eyelids, and this is the Hirsch cannula, which is an irrigating cannula on a bottle of BSS, which is the only instrument that we use for the LASIK procedure. We're using the Hirsch cannula here to prepare the flap edge. Please note how nicely the flap dissects, and we will then reflect the flap onto itself in a taco fashion, and then go in with a Wexel sponge and homogenize the surface hydration to avoid any irregularities in the ablation. This is the treatment plan on the EX500 excimer laser. And again, this treatment plan is placed onto the excimer laser through the network connectivity, directly through the Pentacam diagnostic. We're going to see here a 6.5 diopter myopic correction. The laser is being focused, the tracker is being activated. This is a 1050 Hertz tracker, and this is the excimer laser in action. We're going to break at 50% of the treatment to again equalize the hydration on the stromal bed. And it is clearly remarkable the speed of this 500 Hertz femtosecond laser, 6 diopters treated in about 6 seconds. So we will now complete the procedure in hydrating the stromal bed, reflecting the flap back into place. Again, as I noted previously, this is a completely disposable instrumentation within the flap. This is again that Hirsch cannula I mentioned before, irrigating the flap into place. We try and avoid using sharp instruments and thus avoid epithelial sloughing during the procedure. Again, copious irrigation here. As I noted previously, we use aspirating speculi, so all the irrigating material is being removed from the ocular surface. No other manipulation of the flap. We will put a drop of Pred Forte, which is of milky consistence. It's a suspension, and it will delineate the edges of the flap to assure correct position. Here at Johnston, applanator used to iron out the central striae, which are commonly seen in a myopic LASIK, out to the periphery of the flap. And again, one more drop of suspension to delineate the flap edges, and we will complete the procedure with topical antibiotic, use of afloxacin here, and then a bandage contact lens, which will be placed for 12 hours over the patient's cornea in order to reduce friction with the eyelids and the flaps. And I thank you very much for your attention.